A very good afternoon to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health initiative. IIL was established by the National Dairy Development Board NDDB in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out first varicella culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in ARV segment and present in around 50 countries. Three state of the art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of proven wellness products and infertility range of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility as well and have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and totally revamped it and gave private infrastructure to these government schools. And with our intervention, the strength of these two schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutrition supplement to over 1600 school going children of Telangana and Tamil Nadu. Also, we have facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. To get more information about Human Biologicals Institute, you can visit www.indimune.com. Our toll free number is 1-800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Insta, and Twitter. Also, you can go through our unique initiatives on fight against rabies at www.fearlessagainstrabies.com and everything you want to know about women's health at www.pubertytomenopause.com. Puberty to Menopause is obviously an awareness platform where we try to get all the experts around the country on various topics which you are very much queried about. So, today, once again, I welcome you all to yet another interesting topic of discussion, that is breastfeeding while sick, myths and facts. As we all know, it's a common concern of all lactating mothers that whether they should breastfeed the baby or not while they are sick. To give us more clarity and share her expert guidance, today we have with us Dr. Arti Nayak. Dr. Arati Nayak is a senior consultant at BMC Hospital Bhubaneswar. She is having more than 20 years of experience into obstetrics as well as gynecology, and she has performed more than 10,000 deliveries. She is also a life member of FOXY, IAGE, ISAR, and IMA. She has keen interest in giving publications as well. Till date, she has given more than 10 publications in major national and international journals. She has special interest in vaginal laparoscopy and hysteroscopy. Welcome, Dr. Arti. We are so pleased to have you today on our show, Puberty to Menopause. Breastfeeding while sick, myths and facts. This is the topic which we are having today, ma'am. Welcome you. And first of all, ma'am, I would like to have from you why we are discussing on this topic today and why is it so essential to know about it.
Thank you, Richard. Good afternoon, everybody. Thank you all for having me in this session. Uh, Breastfeeding is the elixir of life. It is the greatest gift of God by a mother to her babies. It is not only beneficial to the baby, it is also beneficial to the mother. So, first of all, it creates bondage between the emotional bondage between the baby and the mother, and it maintains the hydration of the baby because it contains 80 to 90% of water, and it contains all the nutrients starting from carbohydrate, protein, fat, uh, em- uh, antibodies, vitamins, and minerals in the required amount that a baby needs from her mother. And by taking mother milks, the incidence of infectious diseases and chronic diseases is very low, like respiratory tract infection, diarrhea, insulin dependent diabetes mellitus, non insulin dependent diabetes mellitus, obesity, childhood malignancies. And mother also gets lots of benefits by giving milk to her babies. Like, uh, first of all, it helps in evolution of uterus, and it helps in traction of the uterus. By contraction of the uterus,
Dr. Arti, we are unable to hear you right now. I think there is some internet issue at Dr. Arti's end. Dr. Arti, are you available now?
yeah, I am available.
Ma'am, your internet was not proper in between. So can you just elaborate once again on what are the advantages for a mother? From then we were unable to hear you actually.
Okay, I think I have to change my room because here little bit net problem. Can I shift my previous
Of
room?
course, ma'am. Of course.
Yes.
So, as we all know, that from 1st to 7th of August, World Breastfeeding Week is observed. So, this is the week where everybody and the whole world actually tries to create an awareness about breastfeeding and how important it is actually for not only for the child but as well as for the mother. So, till the time Dr. Arti comes up, I would like to just let you all know about what are actually advantages for a child for breastfeeding. As we all say that mother's milk is a wholesome food for the baby. So, it is very much important for every mother that they should breastfeed their kid at least for first 6 months of the duration. So, till the time, Dr. Arti is here, I would like to also let you know about, our initiative about puberty to menopause as well. This website contains all sort of, I can say, information related to women's health, It is also as per the age groups, as well as per what all is required to know for a teenage, like PCOS is there, PMS is there, as well as during pregnancy what all are the informations which are required by a woman, along with the menopause stage as well, like what all are the symptoms, the troublesome symptoms which happen during menopause and how to tackle with it. So Dr. Arti is now again with us. Yes, Dr. Arti, we can continue on, ma'am.
Sorry, Richa, for little bit distances.
No issues, doctor, no issues.
So I was telling about the benefits of breastfeeding. I'm telling that breastfeeding is not only beneficial to the baby, it is also beneficial to the mother. The first of all is it creates emotional bonds between the mother and the baby. Second thing is maintains the hydration of the baby because breast milk contains 80 to 90% of water, and breast milk contains uh, uh, all, all the nutrients, that is carbohydrate, protein, fat, uh, antibodies, and vitamins and minerals in necessary amount that a baby needs from her mother. And a baby taking mother's milk can remain free from the infectious disease and chronic diseases like respiratory tract infection, diarrhea, insulin dependent diabetes mellitus, non insulin dependent diabetes mellitus, asthma, allergy, obesity, and malignancies. So these and coming to the
So,
mother.
Dr. Arti, yes.
Hello, yeah, Richa, is it not audible?
Yes, ma'am. Yes, ma'am. We are able to hear you. Able to
Now
hear
I
you,
am
ma'am.
telling
Please continue.
now I am telling the benefits that a mother gets following giving breast milk to her baby. First of all, it helps in involution of the uterus. By involution of the uterus, we can reduce the PPS, we can prevent anemia. And the most important thing, by giving breast milk to her baby, she can reduce her body weight by loosening the extra weight she had and the extra fat she had gained during the pregnancy. And another important thing, we can prevent breast carcinoma and we can prevent the ovarian malignancy.
True.
And another important thing I want to emphasize that during breastfeeding, she should maintain her position because uh, if she will not maintain her posture, there will be pain in the back, pain in the shoulder, and pain in the neck. So she should take back rest backrest, and she can use pillow 2 to 3 pillows, and so the height of the pillow is at the level of chest, and over the pillow she will keep her baby and turn the baby towards her mother so that there will be skin to skin contact, and by that also we can prevent hypothermia also. And in between the feeding she should activate the baby so that the baby will not sleep, and the baby will open her mouth widely, and baby will um, uh, roll her lips outside, and the baby should suck from the areola and nipple, not only from the nipple. Baby should
From the
also suck
nipple,
from the
right?
nipple and areola so that there will not be any cracked nipple. So I
True.
want to emphasize these things.
Very true, ma'am. So, Dr. Arti, as the topic of discussion today is that can a mother breastfeed the child when she is sick? So, is it allowed or not, and in which conditions she can breastfeed, and how she can breastfeed?
Yes, in a country like India, which is a developing country, if you will compare the benefits versus the risk, the benefits outweighs the risk. So we are advising to breastfeed her baby. By that, uh, the antibodies from mother's blood can be transferred through mother's milk to the baby, so that the baby can fight against the infection.
Okay. So, doctor, for near about how many months breastfeeding is actually, told to mother that she should breastfeed?
Yes, exclusive breastfeeding is essential up to 6 months, and during that period, the baby should not given even water also, and no honey, nothing. only breast milk up to 6 months of life, and after that she can continue for 1 year or 2 year.
Okay. So, doctor, if suppose a mother is sick and she's taking antibiotics majorly, because whenever anybody gets fever and all, first of all, antibiotics they take. So, at that time also, she can breastfeed the child.
Yes, she can breastfeed. There are most antibiotics are said during the lactation phase. Like only a few antibiotics are contraindicated during lactation phase, like tetracycline, metronidazole, and chloramphenicol. Rest other antibiotics that can be given during lactation phase, it doesn't cause any problem to the baby. The safest antibiotics are cephalosporins, that is cefixime and cifuroxime, amoxicillin. These are the safe antibiotic. We can prescribe easily. Following cesarean section, following normal delivery, we are prescribing these drugs.
Right. So, Dr. Aarti, if a mother is having high fever, say, anytime, so how she can manage to breastfeed the child? Because the child may feel uncomfortable with that much of temperature. So, what do you suggest?
No, if the mother is having fever, so she can take paracetamol like that for control of the fever, and after that she can breastfeed her baby. And we have to know what is the cause of the fever, and we have to treat accordingly. But breastfeeding should be continued.
One more thing is there, Dr. Aarti. Now, today's lifestyle with a new generation, I can say, most of the women they also prefer to breast pump the milk and then give it to the child, specifically when they are outside for work or when they are not feeling well. So, what do you suggest, doctor, for this kind of method of feeding?
Express milk is given whenever the baby is very preterm, unable to suck. In that situation, we can give. And if there is a cracked nipple and she is unable to feed her baby directly, in that situation, we can give express milk. But number one is always breast milk. Second is express milk. Third is formula milk. But cow milk and buffalo's milk is not to be given to the baby during first 6 months.
True, Dr. Aarti, because most of the families they do prefer cow's milk rather than so. As Dr. Aarti has suggested, it should be exclusive breastfeeding for first 6 months, not even water or whatever few of the I can say traditions are there. Like they put some 2 drops of honey in the on the tongue or something. These all things should be avoided. So
Uh,
exclusive 6 months breastfeeding. Yes, Dr. Aarti.
at birth, the baby is not having the enzymes to digest honey, so it should not be given to the baby.
Right. So, Dr. Aarti, now the COVID cases are, I can say, we are habituated for COVID positivity and all. But, doctor, this was a very major concern that whenever a mother is COVID positive or found COVID positive, should she breastfeed the kid, breastfeed the child or not?
So there is no so much of data regarding vertical transmission of this COVID from the mother to fetus by this breast milk. But whatever present data shows, it is not transmitted through mother's milk from the mother to the baby, and the severity of infection is very low in case of neonate and infant. So it should be given to the baby.
Okay. So,
And during that period, the maybe mother can use the face mask, face shield also, and before holding the baby she should clean her hand with
all
mane-
precautions,
yes,
yes.
yes.
True. Dr. Arti, there are few families who still believe that if a mother is sick or if a mother is having any sort of skin disease or something, at that time she should not breastfeed the child as this will be transmitted to the child. So, what are your suggestions on it and how this situation can be tackled?
As I was telling, the benefits outweighs the risk. So I think we should advise the mother to breastfeed her baby, and simultaneously we should treat the mother also. if she is having any infectious disease, because through the milk the antibodies are transmitted to the baby, and so the baby can fight against the infections.
Right. Thank you so much, Dr. Arti, for such an elaborative discussion with us. So, I would request all my viewers to post the queries if there are any. Till the time being, if Dr. Arti, if you want to give a conclusion or if you want to give any message to all our viewers regarding breastfeeding, regarding sickness, regarding anything, if you want to tell regarding breastfeeding, please let us know.
Yes, I want to tell one most important thing is, uh, as all of you know, that colostrum is secreted on day second and day third of delivery, and it is very vital for the baby. But it is a dangerous myth that colostrum should not be given to the baby, because it is the infectious milk of the mother. But it is a dangerous myth. It should be given to the baby because it is rich in all the vitamins, minerals, and antibodies. Another thing is, we should maintain the hydration, nutrition of the mother, because breast milk contains 80 to 90% of water. Another thing, we should supplement iron and calcium and vitamins to the mother, because the vital ingredient of milk is calcium, and calcium comes from the mother's bones. And if we will not supplement calcium, there will be osteoporosis, and there will be back pain and joint pain. So we should give calcium. Another thing is, we should give iron, because she had blood loss at the time of delivery. So we have to replace it, and we have to give vitamins also. And breastfeeding is not only the responsibility of the woman, the mother. It is also the responsibility of the family, and it is also responsibility of the society, because we should encourage the mother to breastfeed her baby. And once we will discourage the mother, there will be inhibition of oxytocin reflex, and there is suppression of milk production and milk secretion. So we should encourage the mother for breastfeeding. And once we'll encourage, the feeding will be happy, and there will be healthy child, and healthy child is the nation's future.
True, very true, Dr. Aarti. And one very valid point, ma'am, you mentioned that if you are not, frequently breastfeeding the child, then there are many chances that breast milk production will also be hampered.
Yes.
So to have a natural breastfeeding, it is whenever your baby demand. Most of the gynecologists they say so the baby gives some cues, so whenever the cues are there, just breastfeed your baby as infrequent when the baby demands for that.
Another important thing I want to tell, that whenever a mother feeds her baby, she has to feed at least 20 to 30 minutes, because the initial part of the milk is fore milk, and that contains water, and that contains protein, and that takes care of the thirstiness of the baby. And the hind part of the milk is known as hind milk, and that is rich in fat and rich in carbohydrate. That takes care of the hungriness of the baby. So she should feed her baby at least 20 to 30 minutes. And after that, if the baby needs more milk, then she can shift from one breast to another breast. But most of the time, we have noticed that whenever she is feeding her baby from one breast, there is secretion of milk from the other breast also, and that is not abnormal. That is normal. That is normal milk reflex. We should not be panicked by seeing this.
True. Most of the ladies they do experience this, doctor, and they
Yes.
think that there is some abnormality happening or this is not normal and all these things, and anxiety and all, it also happens, they rush to the doctor also sometimes for this. So, Dr. Arti, we have few queries also here with us. Uh, Ms. Divija is asking that if a mother breastfeeds her baby, if she is suffering with some skin allergies or infections, means maybe, ma'am, for some skin allergies she is talking about, should she breastfeed the baby or not?
Yes, definitely. She can breastfeed her baby, and simultaneously she should consult a dermatologist, that she will tell that I am lactating my baby, and you suggest some medicines which will not affect my baby.
Right. Dr. Ms. Dipali is asking, are the breast milk enhancing drugs harmful? There are few medications available, ma'am, nowadays which enhances the breast milk production. So, does it have some side effects or something like that?
Sorry, can you repeat the questions?
Ma'am, there are few medications for increasing the breast milk production nowadays. So, is there any side effect of such medications on the mother's body or something?
No, we are prescribing mainly one powder that enhances, that is a nutritional product only. Another thing is we are advising to take adequate amount of water and proper nutrition. By that, there will be sufficient milk. And depending upon the size of the breast, there will be less milk production. There will be large amount of milk production. No such.
Okay. Doctor, one more query is there. That my baby actually gets asked for milk very frequently, mostly after every 30 minutes. Is it normal to breastfeed in every 30 minutes?
No, as I was telling, you just breastfeed your baby for at least 20 to 30 minutes from one side of breast. And if the baby asks for still more milk, you can shift to other side. And if you feed your baby 20 to 30 minutes, I don't think that baby will ask more. And I think it is enough. And
Yeah,
how will
thank
you
you
know
so
that
much.
your milk production is sufficient? By urination, if the baby urinate 6 to 7 days, 7 times per day. Another thing is weight gain is around 10 to 20 gram per day or 500 gram per month, then you will think that your milk production is sufficient.
Right. Doctor, one more thing I would like to know. There are few multivitamins, doctor, which are available actually I can say overall health of the mother when she is on the lactation period. What do you suggest, doctor? Are these multivitamins really helpful, and she should take? And if it has to be taken, so for how much of duration she should take it?
Now, as I was telling that iron, calcium, and vitamins to be supplemented at least for 6 months, because exclusive breastfeeding is we are advising for 6 months. For at least 6 months, she has to take.
Okay. So thank you so much, doctor, and really thank you from whole Human Biologicals Institute team for joining here with us and giving us
So,
your valuable
I
tips.
want to ventilate another message. If a
Of course,
baby is sleeping, if a baby is mature and the baby's weight is more than 3 kilo, and if the baby sleeps, the baby should not be wake up from the sleeping position, because by sleeping, there is production of growth hormone. But if the baby's weight is less than 3 kilo, or baby weight is when baby is preterm or baby weight is 2 kilo, we have to wake up from sleeping position, because there is possibility of hypoglycemia. Okay, this is another important message. Yes,
hypoglycemia, doctor.
to prevent hypoglycemia in case of preterm baby and in case of 2 kilo baby, in that condition, we have to wake up the baby from sleeping conditions.
Okay. Thank you so much, Dr. Arti, for joining with us today. And we are so much thankful for all the enlightenment which you have given to us on the topic today. And I would request all the viewers who are watching this that breastfeeding is one of the vital part, I can say, of motherhood. So please do exclusive breastfeed your child for at least 6 months, as Dr. Arti has said. Thank you so much, Dr. Arti, once again.
Thank
And
you.
I would like to thank all our viewers also on behalf of our whole team of pubertytomenopause.com. You can always visit us on www.pubertytomenopause.com for more and more information on various topics which are available and which the viewers are actually querying about. And also, you can suggest us on other topics in which you want to actually know and have an expert guidance. Till then, take care of yourself and take care of your child and enjoy the motherhood. Thank you so much.